basically what I'm going to do today, I would like to, if you watch the video that Jacqueline Vachon showed that was shown during the break, she talked about the retention programs that Dialogue McGill have, and one of she mentioned that there's some French courses, a lot of English courses and some French courses, but that's what I'm going to be talking about today. It's the French courses that we offer with the sponsorship of Dialogue McGill and Health Canada at the French Language Center of McGill University. Now, oops, this is not. Okay, I'll have to read like this because it's kind of blocked. Okay, basically we'll be talking about the future mental health professionals, their needs in the province of Quebec, the early days of our courses, the profile of the students that we have today and what we are doing today, the kind of the courses that we have really quick, how we had to adapt our courses to the needs of future mental and healthcare professionals in general, the contents of our courses today. And towards the end, I'll be also talking about the OQLF exam, which is another exam workshops, sorry, another area that we do in the French Language Center, and the possible future of the French for Health and Social Work courses and the OQLF workshops. First of all, our needs, the needs for, not our needs, but the needs for the health, the future mental health professionals in Quebec. What we have is we offer our courses to native English speakers and students of other languages who are studying in Quebec, at McGill University. They need to improve their French skills by means of taking French courses, because either they have to do their clinical placements in French, or because they want to stay in Quebec and they know they're going to be in a French or in a bilingual work environment, or perhaps both. Now, they also need to pass or succeed the OQLF exams. That's why we have the workshops. They need to do this in order to be able to join a professional college, or what we call here the les ordres, an order, a professional order. Since we have a new reality now, because our students in the past few years, the level has increased at McGill University, and some of the schools are asking for a minimum of a B2 level, B2 in the European, in the common language framework, or in the level 8 in the Canadian benchmark. Since the level is higher, we have to adapt our courses according to the new reality of our students. The profile of our students, they have to be enrolled at McGill University. We have obviously different departments and schools. I just mentioned a few: dentistry, physiotherapy, occupational therapy, speech language therapy, dietetics and nutrition. And the last four, medicine, nursing, psychology, and social work, are more related to mental health, because in the past and also the present, I've had students from those four areas who have actually mentioned that they have to deal somehow with mental patients, especially medicine and nursing, because in medicine and nursing, I have students who are back at university, but they already studied and they already have work experience. So they share that in our classes. We also have students from other departments or schools in health sciences, not necessarily the ones I mentioned, because the student has to be enrolled in a program in health sciences. So sometimes they come from pharmacology, from neurology, from other areas, and they're also admitted in these courses too. And we have students from all sorts of cycles: first cycle, bachelor's degree, master's, and doctorate. Now, the early days, this all started more or less in the decade of the 2000s. There was a professor, Ariel Salvatore, and the Dialogue McGill. That's how these courses started, but they didn't start the way they are today, the way we know them today. I'll talk about that in a few minutes. They took some 300 level courses in general French, because French for specific purposes didn't exist, or for healthcare purposes didn't exist at the time. Let's take an example. They had a course in specific, like reinforcing grammar and writing skills at a 300 level. This course had 4 or 5 groups. They would take one of those groups only for health sciences. So there were sections inside other grammar and writing courses. So that's the way it started. There were not independent courses where students would register in course 1, 2, 3, and in that course they would get health sciences. No, they would have to register in this more general course, and they would be placed in these sections, or sections as we call them at McGill University, that were only dedicated for health sciences. Now, what we're doing today, we've had to adapt. Today we have 7 courses that are offered at the French Language Center throughout the academic year, and they're separate courses. They're not part of a grammar writing course anymore, and they're not only limited to 300 level. We also have other 200 levels, and we might have higher levels in the future. For the time, until the present, currently we have, in the fall session, we have 3 courses in the winter, and 2 courses. We call it the summer session, but it's really intensive in the month of May. They only last for 4 weeks, from Monday to Thursday, intensive. These courses, in the fall and winter courses, the schedule of these courses is in the evenings, so that students who are in their clinical placements or overloaded with courses during the day, they can join the courses. However, the May courses, the intensive in May, it's during daytime, because it has to be like that by, it's the department. We didn't decide that. Now, just to give you an idea of what we're doing really quick, in the fall we offer 3 courses. 209, which is a 200 level course, which means it's A2 if you're more or less familiar with the levels. A2 of the Common European Framework for Reference of Languages, or levels 3 to 4 of the Canadian language benchmarks. That's an elementary level, so they speak a little bit. Obviously, we're not going to teach the same elements in an elementary course and in a more intermediate course. 329, which is for all, I divided into for all professionals because we had to adapt due to our new reality. In fact, this semester we have to create a second group for dietetic students only. I'll start with this one, the group for professionals. So in this group, we have students from medicine, physiotherapy, dietetics, social work, from all the different professions. The level is a low B2, like starting a B2 level, or a B2, what I call B2.1, or a level 7 at the Canadian language benchmark. But as I said, in the past, I'll talk about this one and I'll come back to this one for dietetic students. We had 219, which was only for dietetic students. It's a 200 level course, so it's a lower level. As you can see here, it's a B1. But since, as I mentioned a few minutes ago, since some schools are requiring that students have a B2, minimum B2 level in French to be admitted into the program, the level obviously is changing. So the 219 had less and less students. So we decided, it's not completely disappeared, but it was not offered this semester. And so we decided to adapt and offer another section or another group of 329 only for dietetic students in a higher level. So basically what we did was to adapt this 329, adapt the level, and we have 2 separate manuals which are very similar but not identical. So this one, the one in dietetics, we have activities that are more focused on what dietetic students need. In the winter, we also have, as I said, we also offer 3 courses, 210, which would be the continuation of 209, which is also a level, in this case, it's a level a little bit higher. It's a B1 in the European framework. Then we also have 330, again, the continuation of 329. Sorry, and we also offer, sorry, a course which is called PMCO. We call it PMCO. It's an upper intermediate advanced. We accept students that have a higher level, but it's mainly conversational French. It's 0 credits. This course is very demanded because students really they appreciate the fact that they don't have any credits, so there's no mark at the end of the semester, although there are some evaluations throughout the semester. So I would say this course is quite popular. The level, as I said, they need to have a minimum of an approved low, I'm sorry, a strong B1 or mainly a B2 level to be able to participate in this course. This course is also offered in the May intensive courses that I mentioned before. So it's the only course that is offered twice, but in 4 weeks. It's a different format. It's the same contents, but a different format. And we also have PMCE. The last letter actually is O for oral and E for écrit. So we have PMCE, which is intermediate writing, which is also offered in those 4 weeks in the month of May intensive. Some students, since these two courses are 0 credits, some students who have the availability, what they do is that they join both, okay, which is hard work, but they do it. Now, as I said, that we've had to adapt our courses to the need of future health professionals. First of all, as I mentioned before, the courses in the early stages, we had sections, a section or a group inside a bigger course. That limited the courses because if you have a course that is focused on general French grammar and writing reinforcement, and you only have one small section for health sciences, what was done in the past was a course in grammar and writing, but focus on grammar and writing, but for health sciences. So the courses were more grammarly oriented because of the situation. They had a lot of writing activities that were kind of related to healthcare and social work. And basically, they didn't have speaking or listening activities, which is something students really need. Because, as I said, these courses were part of a grammar and writing course. So it was not intended to have speaking and listening activity. So we had to update the contents to meet the needs of the student that our students have today and the reality that we have separate courses. So now we can, let's say, quote unquote, play a little bit more with the contents of the courses. So we've decided to include the most important genres. I have to explain this word because this is a more linguistic term. It's more a specific term in language for specific purposes in linguistics. A genre is either a written text or an oral discourse that you use in a specific situation, usually in a work-related situation. So just what we had to do was analyze what the needs of our students are and start little by little, gradually changing and updating our courses. And we decided that the genres, the oral discourse that students should really have by the end of these courses is the professional patient interview, because sometimes they'll have to interview a patient, not usually on a daily basis in most cases. Breaking bad news, explaining a diagnosis, explaining prescriptions, giving recommendations. Giving recommendations is also there because it's in the OQLF exam, it's one of the activities. May, not obliged, but may include giving recommendations to patients. So we included that in the oral activities. And in the written activities is all sorts of reports, obviously depending on the level of the course. In some levels, it's very minimal, but in higher levels, they have to do more detailed reports like charts, case histories, and other reports, especially those two, I would say. Now, as I said, the contents depends. We have to adapt because if it's a 200 level course, the level of the student is not high enough to be able to do some tasks at the end of the activity, at the end of the course, or at the end of the class. So 200 level courses are more concentrated on vocabulary related to health sciences and social work, reading, listening comprehension activities, elementary speaking and writing activities, very limited. And elementary, you have to see elementary level grammar. There is a little bit more grammar in the 200 level courses, because ideally a student should have, when a student has a B2 level, that's when they can really perform a lot better in a professional setting. So The 300 levels are already a B2 level. Here we can have not only vocabulary, but also medical terminology. We have speaking activities like the ones I mentioned in the previous slide, interviews, diagnosis, recommendations, writing activities that are more focused on what they're going to be doing in the future, like case history, charts, written recommendations, again, because in the OQLF exam, sometimes they have to do that. And we also have reading and listening activities, but in a higher level, and task-oriented grammar revision. So grammar is less, let's say, less important, although it has to be there. OQLF exam preparation workshops, that's the second area that we work on. Usually, or most of the time, it's because we have meetings. I have meetings with the different representative of the different departments or schools of the Faculty of Health Sciences. So when they know they have students, they have a cohort of students that are about to finish their bachelor's degree, they they make a group and we communicate and we create a workshop. But that's not the only way. Sometimes students themselves, they approach me, listen, I'm taking the exam in a few months. Do you offer something? So if we gather a group of at least 3, 4 students, I organize a workshop with them. Now, the workshops, it's usually a minimum of 4 to 8, minimum to a maximum of 8 students. Of this, we try to have them of the same field. Sometimes when there's no choice, we put fields that are kind of similar, like physiotherapy, occupational therapy in the same workshop, but that's not the ideal, because in reality, the workshop at the OQLF is by profession. It's done on Zoom. We started doing it on Zoom during the pandemic, like the rest of the world, everything turned into Zoom. Now, the thing is that we realize that students prefer, because sometimes they just finish as I said, with the courses, they finish their placements and they want the workshop, which are usually held in the evenings. And they said that is more convenient for Zoom, so we just kept it on Zoom. The courses, for instance, the courses that I mentioned previously are in person. They have been in person fully in person since 2023. They were during the pandemic. They were on Zoom 100%. Then we went hybrid for like 1 or 2 semesters, and now it's completely in person, like it used to be before the pandemic. Anyway, back to the workshops. More recently, with Dialogue McGill, we've decided to open the possibility to the professional public to join these courses, but this is just starting. Okay, this has not been like 100% working. It's something we're doing right now. The minimum level to be able to participate in a workshop is a B2. I've mentioned before that B2 or 8 in the Canadian benchmark is the minimum level to require to be able to perform correctly and in an acceptable way in a professional setting. And the objectives of these workshops is to familiarize students with the structure of the exam. It's not a course, I always insist. We just meet to do as if it was an exam. It's like a mock exam. We just do it like an exam. I have different exams, or I prepare new ones and adapt to different professions. And I do, and let's go to the next slide, the 4 parts like in a real OQLF exam. So there's a reading section with a common case study, then a speaking section, a writing, and another speaking. Part number 2, which is speaking, the difference is that they have to speak with a group of professionals of the same profession. So it's a meeting in which they have to discuss the information that they read before of the case study. And part 4, it's also speaking, but they have to speak with the caregiver or the patient himself. So it's a one-to-one conversation, not a group speaking activity, like the one in the real workshop. At the end of the workshop, I give them feedback. Obviously, I cannot give a grade, a mark, but I tell them we use the grid that are published, but the OQLF has like a grid of an evaluation grid. So we see the grid and I tell them, I think you're doing fine, but I can never say, yes, you're going to pass, because you never know. But usually I just tell them yes. Or if I see that the student needs more courses, more reinforcement, more to improve his or her French skills, I just tell them too, listen, your level is not enough. I have to be honest and tell them. what the future of our courses and workshops will be. For the courses, since as I mentioned before, some admission requirements from some departments is that students need to have a minimum of a B2 level, and every department has their own way of evaluating this, especially nutrition, medicine, occupational therapy, physiotherapy, nursing, and dentistry. Those are the ones they require students to have a B2 level, and I have the feeling that the rest of the schools are going to join. So obviously, our lower level groups are losing students. And for example, as you saw, we had to create a second group for dietetic students because the 200 level course, the B1 course is not enough. So we had to raise the level. And there's a possibility of creating a C1, a more advanced course in the future. And we don't know what the future of the 200 level courses will be. That's a question. It's an open question. What will happen to elementary 200 level courses? We don't know. If there will be we continue to offer them. That's something that we'll see with time. And for the workshops, as I mentioned before, not only will continue offering these workshops to our regular enrolled students, but also to professionals who are not enrolled at McGill University. And as I said, this is something that we'll see how it goes because we just started. And with this, I finished. I hope I was in time. I haven't checked my time. So thank you very much, and I'm open to answer to any questions.